Hey guys, Jordan here, Andrew, GovTech Advisors. Really excited to bring a little bit different of a solution to the GovTech Advisors podcast. As you guys probably may or may not be aware, May is Mental Health Awareness Month. So we're really excited to kind of help drive awareness. And we've got Mr. Joe Ramirez to joining us today. So what we're talking today, mental health, Lighthouse Health and Wellness. So I'll turn it over to you, Joe, just for a quick introduction and kind of who you are and what we're talking about today.
Awesome. Well, hey, first, thank you guys very much for the opportunity to share kind of our mission that we're trying to do with Lighthouse here. So really quick background on me, Joe Ramirez. I'm the founder and CEO of Apex Mobile and Lighthouse Health and Wellness. My background before I got to all this was a finance guy, way back, graduated college, 99, worked at Bank of America, was in the fund mortgage industry for a while, and got really into technology. So from this side, learning how to generate leads online. So I fell down a rabbit hole of, this was 2003, 4, 5. How do you make things appear at the top of your search results? And there wasn't even Google when I was goofing around with this, it was Yahoo. So I kind of started teaching myself how to program. So kind of fell deep into the technology side of that world. Of course, when I got good at it, the industry exploded. So I ended up selling that company to a tiny little company to a company that did the same for doctors. Took that company, it was lead gen for plastic surgeons, your cosmetic type stuff. Lead gen for them, grew that company from 90,000 peak revenue month to about 300,000, and we were acquired by a public company, Internet Brands. Now, not many people know who Internet Brands is, but they probably own and run at this point a lot of websites that you know and love every day. I became the founding general manager for their health division, which will play into kind of why I found the Lighthouse project so awesome, and ended up being the general manager at a public company, growing consumer-facing health websites for 4 or 5 years. Eventually left there because I thought mobile apps were really cool, and I was tired of fighting with Google and search engines of ever-changing marketing ways, as you guys, I'm sure know of what are we going to do today to make my thing appear where it needs to appear, exactly. And kind of wanted to put that back in my own hands with developing platforms and technology. So left there. Kind of cool seeing them grow. Wish I stayed a little bit longer. They ended up acquiring a small little web health website called like WebMD that kind of put our doctor matching, our doctor matching philosophy and technology behind it. But sold that and got into the app world. I kind of said apps are really hard to make. I'm like, so how, if we can make apps easier to do, they can be more accessible. So this is 2011. Left a couple years, did both. 2013 left Internet Brands to focus solely on my app building platform. What I thought would take me 6 months took me about 6 years to finally get done to where I thought I was going to be. But on that path, I built apps, but I didn't really build them for myself. So people, what kind of apps do you build? Well, I don't build any apps. I build apps for other people. I tell me what you want your app to do, and we configure our platform to do it. So if you're familiar with WordPress, I kind of explain it as a WordPress for apps. So I was kind of wandering the wilderness trying to sell an app platform that built apps, and stumbled into law enforcement. So it was the first apps that we were building that I could hold up an app that we did for one agency, show it to another agency, and they go, oh, I want that. And because we've already built it, it was part of the platform, we could configure it and kind of scale out that way. So our Apex Mobile brand evolved out of that. And primarily for the past 6 years, I'd say I've been selling to public safety agencies. So outside of our health project, we work with over 100 police departments, fire departments, a couple state organizations, from your LA County sheriffs, Phoenix PD, so kind of as big as you can get, down to a 2-person agency in Washington. So we've run the gamut. It's primarily their community engagement application. So apps that the agency will put out, you can send in tips, they can send push notifications, and do that type of communication. So that's the long way to get us to Lighthouse. So through that, I got introduced to the 100 Club of Arizona. And I don't know if are you guys familiar with 100 Clubs?
Oh, I was born and raised in Arizona, so I'm very familiar with them.
So 100 Club of Arizona, 100 Clubs, typically they're regionally or locally based. Arizona is kind of unique that it has a statewide one. And they've got a pretty cool mission. Typically, every 100 Club, they're the organizations that provide funding, or in the event somebody, an officer or public safety, somebody is killed or injured in the line of duty. So they'll provide immediate financial assistance, just as a nonprofit to support those communities. Well, Arizona has a much bigger mission. They do a lot more proactive work throughout the state, and they reached out and we got a bid solicitation because they wanted to build a program, 2 apps that they could give to every single police department and to every single fire department across the state for free, that would allow them confidential and anonymous access to wellness resources. So there was a bid process, and we ended up winning that bid by an amazingly different factor, which we'll get into kind of why we're doing it the way we're doing it. But the amount of money that people wanted to build what we could do for fractions of the cost was pretty eye-opening to me. And so we won the bid, and I spent a year building these products. So they've got bulletproof and fireproof. So if you look up 100 Club Arizona, bulletproof, fireproof, these 2 programs that were rolled out across the state. But in building it, I got to spend a lot of time going to events with them. And I've been selling to public safety for years now, but I was sitting on the other side of the table and having, I was just there to help explain what we were trying to do. And I'm having, chiefs in uniform walking up to me, thanking me for everything that we do for them. And it was just a mind-blowing experience like that. It's like, no, we thank you guys. I don't know. I'm just a vendor over here.
Sure.
But it was just amazing. And then learning about the other programs and things that the 100 Club of Arizona does. So as we got into that, I kept thinking like, okay, hey, well, we've built this, now here comes my platform background. Okay, well, I've built this for an entire state. How much different is it to do it for the nation? We've built it. So I'm starting to tell them, you guys should really take these programs national. You guys, come on, you guys need to make this bigger. And finally, they literally told me to shut up. Like, we can't, we're funded for the state of Arizona, Joe. Like, right. Like this is our box. We wish we could, but here's our mission and where we're going to go. But you have our blessing to take the program and what we've learned and offer it to everybody else. So this was 2000, end of 2000, or 2000, I get my years lost, but beginning of last year, basically, right before COVID, everything flew into fun. We came up with Lighthouse Health and Wellness. And we launched Lighthouse Health and Wellness with a mission of ensuring that every single public agency in the United States has the ability to provide its employees and those that support them with confidential and anonymous access to health and wellness information. So that's literally the core of our mission, is we want to make sure that everybody out there has a path that they feel they can go through and be safe to research things that might be available to them. So we formed
Joe, what would be in there? So tell me, like, what does Lighthouse do? Like, what would an agency put in there?
So Lighthouse is composed of the core Lighthouse platform that we started with is composed of about 40 to 50 topic areas. So mental health, we can go through PTSD, depression, alcohol abuse, to yoga, resiliency. So all these topics, think of the content in there as a mini WebMD written in the voice of first responders. So 50, 60 topic areas, surveys that you can take, like personal assessments, depression, PTSD. So it's just this nice little library that works for literally any, it's the same thing for everybody in that case, but somewhere they can just go to find research. So that's one component. The second component is being able to load in, as we discover them, resources that are available for them, be it, national hotlines, local therapists, and things like that. So that's kind of the core of it, is just putting all that information into one simple app that they can go through and use. So that's the library of resources. What Arizona doesn't do yet is but they don't offer every agency an individual app. So there's a central app everybody can go to that loads all the information. So we kind of combine the two in the Lighthouse program and say, hey, you still have the ability to go to our website, lighthousehw.org, or Lighthouse Health and Wellness in iOS and Android app stores. And if your agency is participating, we give you an agency code, and you can then launch into the app and access all these resources. We layered our own app platform on top of that from Apex Mobile to be able to do a customized app for an agency. My belief just being the more custom we can give, the more interaction and the more uptick, the more adoption they're going to get if it's something that's truly tailored to. And when I say agency, it's whatever blanket may fall over that's providing health and wellness to a specific subset of responders agencies, right? Like, again, LA County Sheriff, they've kind of got their own gig. They're big enough, to do, but you've got, agencies that are spread across southern Massachusetts that only have 5 to 15 employees each. So there may be a collective that sits on top of that works with them. So whatever we can do to brand it to make it, as relevant as possible to that agency at the local level. We're able to go out and do. So essentially that's what it is. It's an app that comes with two main components: a library of pre-built information, but then that is also extremely customizable to be able to load in information that's relevant to that agency. That could be lists of local therapists that they work with, chaplains. If I have one agency that's going and working to find restaurants in the area that provide healthy meal options. So being able to say, oh, you're going to go to this restaurant, here's what you can order. Here's the flavor of the month diet. Well, here are the things we recommend at all these different restaurants, and they can pop up on their phone. Where am I going to go to lunch today based on their location? So we can dial all that in based on the agency itself, the resources that they may have. And then we can cross share resources between agencies too, so being able to become a little bit of a repository that goes, oh, hey, you don't need to recreate the wheel. We've done that over here. What we don't at all provide, we're not therapists, we're not providing training, we're the conduit to help get them to resources that they're out there and available. And we try and focus on resources that are paid for, so as you fall deeper into the wellness rabbit hole for first responders, it's pretty quick once you think about it. It was kind of weird, as I said, my experience with the 100 Club was just like, it was mind blowing once you first wrap your head around, wow, this is such a problem. How do we help these folks? It's obvious when you sit there and think about it that, they're going through a lot of stuff. And, so it becomes more obvious that there's going to be people that need, that deserve and need some assistance, some help, and some support. But then you follow the other side of it and you realize there is such a critical lack of funding for this stuff. It just really doesn't exist. So when we launched Lighthouse, we originally had it being kind of a paid model if they wanted to have their own custom app, but we got a grant through Motorola Solutions and the National Center for Prevention of Community Violence to do custom apps for our first 15 agencies.
Wow.
So we got a tiny little agency like LA County Sheriff was able to come on board. Chattanooga PD, we're proud to be working with Portland PD. They've been going through some stuff, and 15 other agencies, and we got to build these apps out. Well, it ended up being way easier than we thought. It literally takes us a couple of hours to put an app together, a basic app for an agency. So we kind of I just said, heck with it. I'm not gonna fight over $200 to $300 of cost if we can put this in somebody's hands. So we just made our core platform free, which will now includes that custom application.
Is that where the designation of a nonprofit, but more of the for public benefit corporation kind of came into play?
So we kind of launched all this, announced it. I think end of February last year was the IACP Health and Wellness Officer Safety and Wellness Conference out in Miami. So that was put the banners up. That was our first thing. And then COVID, right? Wham. But before even we started it, I wanted it to be something, I hope that I'm not the one doing this in a year or two. I can get into where I hope it's going to go and what I hope to do, where I hope it grows. But we set it up as a public benefit corporation. So if people aren't familiar with public benefit corporations, it's essentially a normal corporation. But you're able to state in your corporate documents that you have a public benefit mission. So you can get out of my only thing I want to do is return, as a corporation, your mission is to return the maximum value to your shareholders. Well, we essentially are saying, no, our mission is to ensure that every public safety agency in the United States has the ability to provide its folks with, these resources. And by being a public benefit corporation, it allows us, I feel, to move quicker. So I've given the technology to do this to Lighthouse, which is a standalone entity. So that's kind of a royalty-free thing that it's going to be able to use forever to continue to do this. But what that allows us to do is be so much more flexible in our funding and in where we can spend our money. So, it can be coming from grants, other support from other like-minded folks that sell into public safety, and that's how do we keep this going? How do we do this for free? It's easy for us to do, kind of the point I was trying to get. It's easiest for do at the moment because it's literally our platform. We run it. It takes a few hours at the most to do this for an agency, and we're happy to do that. We're approaching, I think, 60 to 70 agencies now that we're doing custom apps for. And really, we just came out of the weeds like everybody else a few months ago, so we're starting to gain a lot more traction with it. Agencies can, if they choose, pay $500 to help with updates a year, but we're never going to take the app away. So I think it's critical to know for any type of program, I mean, and especially your health and wellness, these types of programs, it's got to be sustainable. And one thing that is not sustainable within government and public safety organizations is budget. You just never know what's going to be there. And I think we all learned that a big lesson last year. I had agencies that at one point were like, yeah, we're going to fire half of tourist areas, right? It just evaporated. We're going to lose half of our staff. Like everything is going to change. And unfortunately, I don't think the world's going to be much different in that type of volatility that we're going to see. So it's got to be something affordable. So we, at $500 a year, an agency can contribute. So, right, you guys are doing technology, iOS, new Android phones. We've got to do work to keep the thing updated so it keeps opening on everybody's phones.
Sure.
Oops, we've got to now relaunch 500, 1,000 agencies at some point. There's got to be something behind that. So they can contribute. We go $500 just for an update plan. Every agency, 100% will get an update every year. That's out of the question, but if they can. We have a extended service project, which is $2,500 up to 75 employees and then $2 per employee. And what that lets us do is actually be proactive. So we'll get them up, we'll help them launch the app, give them promotional materials, get them through launch. But once it's launched, we have a monthly kind of support email that goes out. If they do our support plan, we're going to be more proactive. So we're going to have people that can call them and say, hey, you're an agency of 500 people, you only have 25 installs. What's going on? What else can we do to help you with? What are we missing? And be a lot more proactive in that. And then we also have a plan that is service and programming. So $3,500 a year and then $3 per employee beyond 75, where we will take dollar for dollar any money that they have, half of what they give us at a minimum, plus any other dollars that they get, and help them spend that on health and wellness programming and initiatives, and help them find the places that their dollar is gonna go good, gonna be spent in the right way. Any money beyond that we don't return directly to an agency that we work with goes back into supporting health and wellness at the state, local, and national levels. So, last year we made donations to, it wasn't a ton of money that we got from Motorola. We launched 15 agencies, yet I was still able to give thousands of dollars away to Copline. If you don't know what Copline is, amazing organization where it's just a toll-free, staffed by retired law enforcement agents who are law enforcement folks who've gone through a full week, 8-hour days of training to be able to handle peer support calls. So retired folks that have been in the shoes and walked the walk with them. And just other organizations like that we were able to support. As we go into new states, we join the Police Chiefs Association, the Fire Chiefs Association, find the nonprofits that are doing work within those states, and direct whatever funds we have left back into those nonprofits. So any dollars that actually come in through the program in some way, shape, or form are going to go back out either to developing more programming and resources or supporting those folks that are doing the boots on the ground efforts out there with it.
You brought up a really good point there at the end, the boots on the ground. So when you look at the agency or an organization, who manages what should be in there? Where is this data, this information, who's driving it from a localized level?
Roll the dice, and it's scary to say that. There's agencies where we are literally our app with I call it the oh crap button. I need help now, toll-free number, a link into our just library, our little mini WebMD library. We have a link to CDC by default for COVID stuff. For some of our agencies, that's all that they have. For others, they've got I'd say, I feel that in a lot of them, there's the peer support folks are primarily volunteers. They're people that have full other jobs, but they've volunteered to be on the peer support team. And that's going to run from, folks that have gone to the one of our other partners, International the Critical Incident Stress Foundation, ICISF, that does CISM training, crisis, post-crisis management training. There's some folks that have gone all the way through that. There's a couple of great organizations that are doing peer support training. Amy Morgan, certified peer support counselor, is one of them we're working with, and she's got an incredible library of free videos that she's made available for folks, just for personal health and wellness type stuff. But it really runs the gamut, or all the way to an LA sheriff, right, where they've got a division of 20 plus people that are responsible for this. But there doesn't seem to be, to me, any real path. It's very custom to an agency, and in more agencies than not, it's somebody new going, I think we need to do this.
Yeah.
Right. Well, how do you guys determine? So you made a really good point too about getting, resources and things from other agencies and sharing. How do you understand, like, okay, this is something? Is it your staff? Is it somebody else that sees it that says this is a great piece or resource from this agency? We should have this available on the national platform. And how do you share that information? And more importantly, I'm sure when they're making it, let's say it's for Albuquerque, right? It's specifically tailored for them. Who is responsible? Is there somebody on your team that says, this is really great content that needs to be available? Let's kind of make it in a way that can be ingested by all the agencies that are on the platform.
Yeah, so we still do a lot of work with our Arizona, 100 Club of Arizona partner.
Mm-hmm. Yep.
Where they really spent the time vetting and developing the initial core set of content. Right. So that's primarily where it comes from. When we're sharing things right now, it's kind of like checklists or just ideas. Hey, here's what we heard somebody did with. It's typically not a lot of stuff that we're formally adding into the directory for everybody to go use at this point, to the point of we don't have anybody on staff doing that. Right. So there's things that you can look at and say, okay, LA County, this is, you can judge the authenticity. Is it cited? Is it sourced? Where is it coming from? Is this something we want to add for everything? But I think right now it's more so just adding, sharing the stories between other agencies, and how are they even getting it out? And a big part of it, and it sounds sad and we're not even getting to where we should be, but it's literally those two buttons. Hey, if you're out there and you need to talk to somebody, you can call this phone number anonymously. Or if you're like, hey, I'm drinking too much, where can I want to, whatever it is that's on your mind, I can click a button and go read that. Or, man, I just saw a really, really bad call, like I need to calm, I'm yoga, I should do, something. Just give them somewhere they can go do that at a very basic level, and it sounds sad, but literally, a one-page thing that can go say, hey, here's the place, and then link them off to IACP, right? Let's send them off to other folks that are doing resources. And that's the part as we grow now, we actually kind of shut down I shouldn't say shut down, but very much slowed down our directory building, because there's a lot of people, back to my money part, there's a lot of people that just want to make money off this stuff. They see government problem and there's going to be a big contract somewhere. And tragedies happen. People show up with these tens of $1,000 programs. And I just fundamentally believe that there shouldn't be a paywall in front of first responder wellness. So one of the biggest things that I'm trying to do is vet resources and work with programs that are giving something good to agencies at no cost. Understanding we've all got to figure out a way to survive in the long run, but that's a challenge. Certainly, that is a challenge for us right now. And I think as we continue to grow, that's where the majority of our staffing time is probably going to be, is how do we either develop these resources where we're going, if we can build it once and it costs us $10,000, but it's done, again, I get it. If you're trying to, we're selling push bars or community engagement apps or whatever else it is, right? Your RMS or CAD systems, there's all this other great stuff. Cool. Let's go make money doing that. But if collectively we can do something and hand it over because it's done and know that it's a good resource, I just, can't understand how people can just look at that as a profit play. You got to make money. I get it. But for this certain thing, I challenge, and this is, whoever watches, definitely put this part in. I challenge you to find me dollar for dollar something that can impact our community and our nation better than making sure that our responders are physically and mentally as good as they can be every day they go to their job. And literally $1 can make a difference in that. And I'm still trying to think of it, but where else can we spend money that effectively that I think is going to have that biggest butterfly effect, right? They show if they're having a bad day, well, they've got their own world, the people they work with, their families, right? But then think about us. I kind of laugh, and even when I sell my other stuff, I usually don't have to deal with, public safety. It's one of two reasons. Either I called you to come help me, or someone called you to come deal with me, right? In either case, I'm really hoping you're having a better day than a bad day. Right, because that's going to, personally, as just someone who doesn't care, fall on whatever side you want of the spectrum on this, politically, but it's a no brainer, right? Like, so So anyway, so I'll get all ramped up when I talk about it, but fundamentally that's the biggest piece is how do we do this? But collectively, it's a problem that can be solved if we're not trying to solve it, on a micro scale.
Right.
It's while every agency is going to be a little different, a lot of it should be able to be shared and used across these agencies. And there's a number of, that's the other part is, I'm a year and a half into this and I'm still learning about these great resources and organizations that are out there that are doing phenomenal work, but nobody knows they exist.
Yeah.
Well,
and I think it's important. You and I talked about this kind of offline here. I think it's important to understand when you're providing directories and things like that, this is just another tool in the toolbox, but not necessarily to replace talking to a professional or anything like that. Can you kind of talk a little bit about that?
Yeah, 100%. And I think so as you go through, if you get into this, that's what most of these, the hotlines and support lines will do is they triage into, okay, you had a bad day to it's okay to want to go talk to somebody. Right. So that's kind of the first step is, and if you've survived first, I don't know if you've run across Doug Monda, a lot of great organization, does a lot of great speaking and is an incredible story. But one of his first things is, you'll get an agency that's in crisis. You run in and it's like, okay, we need to build a peer support team. We've got to put all this together, but you can't do that until the folks kind of feel safe to go talk to somebody. Right. So if an agency is in crisis, you can't just slap a peer support team immediately together because you got to help them all first so that everybody in the agency is capable of handling that. But to step that back, it's okay to talk to somebody. You can go now talk to a therapist, right? So go find some, does your organization work with anybody? Here's your EAP information. Okay, well, I don't trust my EAP. Well, is that valid? Is it okay? Like, let's try and suss that out with an agency and make that. But another thing is if someone goes and talks to somebody and has a bad experience. So I think the other critical thing that we're missing in this whole piece is trained therapists. First responders have a very unique, set of circumstances and problems that they go talk to. And if you walk into a therapist that's never heard these stories before, you kind of, Dr. Dara Ramsat, he's out in Arizona as well. And it's like therapists end up needing therapists after talking to first responders sometimes because of everything that, gets dumped on them, the things they've seen and done. Mm-hmm. So they've got to be culturally competent as well. So that's a whole separate side to this is helping. And FOP is, hopefully is going to be releasing they're working on a big project to release a vetting process for this. But step one is just getting them to realize it's okay to want help. And there's resources that you can call anonymously and talk to. And that's who I'm trying to connect them with, right? Is people who've been through it, organizations that are vetted, that, a phone number, there's a Fire Chief Association has a crisis line. There's different folks of organizations who are building that part of the unit. We just want to make sure and help build the awareness that those phone numbers to start with are there at a baseline case. Those organizations, let's say we go to an agency that has no other program. Well, those organizations hopefully can then help direct them to, if they need that clinical next step. But that's the other hole. Not only don't we have enough people at the agencies making this an organizational priority, or in our government that tells our agencies what to go do, we don't have enough therapists trained and vetted on how to deal with first responders. So that's a whole other side to the equation that I'm glad you brought up there. But I can see it even in a year or two, the difference in amount of organizations and people working to try and start moving the ball forward on these. It's moving rapidly, which is pretty cool to see.
Yeah. I mean, on my LinkedIn, on a lot of different resources, I see a lot more about mental health being discussed and mental health resources being discussed. And I'm sure that there is a massive stigma of people saying, I am hurting. I don't know what to do. And so how do you guys build the trust within a community or within, entity that decides to do this? And because I could see a lot of people still mistrusting that it is anonymous or that somebody is not making sure.
Yep.
So, I'm sure that in itself, the advocacy, the education that, yes, it's okay is probably an insurmountable task in some cases, but how do you guys navigate that?
Yeah, we don't really well yet. I mean, to be honest,
Okay.
it's something you launch an app, and exactly how do you do it? So we try and say,
Right.
hey, it is anonymous. So I think there's two components to it. One is we're learning. So we've got 50 to 60 of these things in process. So we're actually now getting feedback, seeing the usage. We're able, by launching them, we're able to start seeing what the real concerns and problems and what's the questions and how do you think? And I think a cool part is, well, we're FirstNet verified, right? So not that they know what FirstNet is, but then I can introduce that and direct them saying, well, our Lighthouse app is made it through the FirstNet platform. They've looked at us, and you can't just be anybody off the street to get onto that network. So that's a huge step for us, saying, industry wise, don't care what I say, what anybody says, here's this organization that's dedicated, right, to figuring out tools and products that you can use that work and are validated, and we're keeping an eye on them. So that piece. We're also AWS technology partners in the public safety space. So we're continuing to work with them. And that's where kind of our, thankfully our knowledge on how do we make things secure for law enforcement, we kind of have not the perfect understanding, but a good understanding of where could the holes in this be, what leaks out of it. So we've got that piece, but also we don't run third-party code. So once you get into the site or our apps, we track what was looked at, what button was hit, but never who looked at it. So we have nothing that would ever tie a person into, going to take a survey or do anything like that. So it's just educating and finding those questions first. Second is it's just longevity. That's where it's got to be sustainable, because we're not going to crack the nut in year one. We're probably not going to crack the nut in year two, maybe year three. It's having somebody in the agency and us, or somebody that knows us, making a connection with somebody at that agency to build that trust, outside of the app and the product and whatever, but say, hey, no, this is a real organization, and I used it, and getting people to share internally that, hey, this is a good resource. And I really think that's the way to do it. And then just overall education. I mean, that's, as we continue to grow, we've got some plans to be able to actually, send out, have some influential folks within the community talk about the product when we launch it with an agency. So they get a push notification that says, hi, I want to say who, but hi, I'm XYZ. Here's Lighthouse Health and Wellness. Here's my story. You can trust this organization. So bringing other trusted voices, because I always walk around, I'm just a tech guy, right? I'm not a cop. I wasn't a cop. I kind of believe in civic service, and I look at this as a really cool way that I'm able to take what I've done professionally and give back to it. But I'm still never going to be someone that walked in their shoes.
Sure.
So it's finding more of those people to get behind it in the long run.
Well, let's take a step back, because I think one of the things you said, you partnered with FirstNet, you're FirstNet verified. Tell us a little bit about more how you're working with that, because I think a lot of we've recorded another episode. We talked to another FirstNet partner earlier, and I think people are starting to understand the mission and the drive of that group. So tell us kind of how are you working with the FirstNet team now that you're verified?
For sure. So FirstNet hired Dr. Inquiry, and she reached out to us. I think she started at some point last year, and she's got a background, if I recall correctly, in the military. And she'll probably say, no, you dummy, that's not what I told you. But background from the military, building health and wellness protocols for the military. So they hired her to come in and say, hey, from what I understand is we need to make a focus on the FirstNet level, right? On how do we use these tools and things and find services through the FirstNet apparatus and network to help foster health and wellness of our first responders. So she's gone out and started collecting those of us that are doing work through FirstNet that are working towards health and wellness for them. And so like now we're being invited. So right, I'm a little public benefit corporation. I can't afford to go to all these conferences and get the word out. They're helping to go out and say, hey, Joe, we're going to be on this podcast. We're going to be on this event. We're going to be doing this. Would you like to come join us? Can we feature you? I got to present what we did to the entire FirstNet kind of, rep network that's out there working with agencies. So they're early in the program, but I think it's the identifying the resources phase and then connecting us as well, right? So she's connecting me with other folks that are in the space saying, hey, I think you guys can work together. And I think for me, that's something that's astronomically important. They've got a lot more clout than I do. So them knocking on somebody's door and saying, hey, here's a cool organization, they're working with us that we think you guys should connect. That makes a huge difference for us in terms of the exposure side of things. And then just they sponsored the the IACP Officer Health and Wellness, or OSW conference this year. They were the lead sponsors for that. So getting out there and helping coordinate the programming. And I think sharing across the communities is really important. And having somebody with that background being able to sit at that level and start gathering up these valid resources. So, when, if X, Y, and Z other organization wants to do an event and bring in health and wellness, the level of the collection of resources that FirstNet can bring and vet, right, and get behind. You're not spending all your time trying to put together the speakers at the conference, right? You know who you need to go to. So we're early in it, but I'm excited about it, and they've been really awesome, partners they started talking to me before we even launched our first set of apps.
Wow.
So they were very proactive in reaching out. Now it's a little more fun from my perspective, because I think if everybody that we work with gets these distributed on their phones, we have the potential to touch, I think we're up to 65,000 responders right now.
Wow.
And we've done that in under a year. Granted, they're not all deployed. We're still working on, okay, big organization. Sure. Why do you only have, but, we're working with them to start spreading that message. Obviously FirstNet gets a much bigger number than that, and it's awareness. And I think, again, I'll just go back to, all we're doing is making a couple buttons that are pointing to stuff that existed before we did. Right. We're just helping make folks know that there's resources out there and available to them right now at no cost in a lot of cases, right. At least for somebody to talk to, at a very basic level that you can feel you can have a conversation with somebody. There's a number of folks there, but.
I mean, it's just incredible. And also just a real quick caveat for everybody that's on the podcast right now that may not be aware of what FirstNet actually is. So FirstNet is a dedicated network for first responders. So when crises happen or they want a dedicated network, there's certain things that the federal government put in place in order for them all to be able to communicate together, communicate during times of need. And part of that initiative is to have mission critical or resources and applications like Joe is talking about right now. And so they, of course, need to work in the most extreme situations, and they need to be secure. And so FirstNet kind of goes through that. And so that's what Joe is talking about. And for those of you guys that may want to look up that, I'll put some links in the description as well, so you guys can continue researching that too.
So Joe, we've kind of learned a lot today. How do us, Andrew and myself, and anybody who may be listening to this, how do we help you? Right? You had mentioned it's an awareness piece. How do we help you? Because this is a very important thing that you're doing for everybody, really.
That's a vast understatement for sure. Yes.
Well, and it's cool to getting more people in it, because it's even us that aren't there, getting more people that are, I'm assuming, your folks are people that are catering to this space.
Yes.
So I think there's two things that it is one is just if you think there's an agency that could use some health and wellness help, just let them know we exist, because we're a good door that's not trying to sell them anything, to lead them into that discussion. Here are resources. We can point them in the right direction, from a very basic point, and we can also give them something very quickly to put on their phones. We'd really like to find people in states. So I don't want to rattle off our states till we're all formal yet, but we've got a cool program in Arizona. We have multiple states that we're working with. So to your point of how do we know what to do? Well, we need partners in all these states, right? Like, I don't know what to do in Michigan. I barely know what to do in Orange County, but, but finding partners, and it's both from the nonprofit side and from the corporate side that can make the introductions, right? And say, hey, okay, we believe this is important, and we know who all the players are. So I think not only introducing us to agencies, but if there's somebody out there that works for an organization that says, hey, we'd like to figure out how we can help and do this, and it's I call it the PBS model, it's the thanks to the generous support of, we're going to help make it do that, but we're not like, I'm, harping on it. We're really not trying to make it any kind of a sale piece. It's just having folks. And I think there's a lot of us out there that are like me that go, you know what, I'm going to build a really good life by selling stuff to these guys. The least I could do is scrape a little bit off my marketing budget or time, and try and help facilitate this part of it. Because unfortunately, the agencies aren't doing it, right? Because they're not getting funding from whatever organization is above them. Societally, we haven't made this a priority. And, who can do something to help right now? Collectively, we the vendors can. So if anybody's interested in seeing, what opportunities, and we're very open, it's just kind of like, we know it's going to be a collective effort between public, private, kind of nonprofit folks, a different model of working together. I didn't dive into that with the public benefit side, but it's truly a different model of kind of bringing all these organizations together that do share a common goal that might not be, profit or a certain KPI, or something they're going to need to do at the agency level. I mean, obviously healthier people is there, but I think those are the two biggest items. Just if you're interested in seeing what you can do to help, and it doesn't have to be big either. I think we have a car dealership somewhere that one agency had that was like, okay, yeah, we'll help them with this project. This is a really cool project. Some, the Chevy dealer in the local, that sells them their cars. So it doesn't have to be some national big organization. There's a lot that can be done even on the lower, further down levels as well. So for me, that's it. Just exposure. Just let people know we exist. And if it does come up, they know there's somewhere they can call, to say, hey, we're trying to start. Or if they are spending a ton of money on something, can we redirect that dollar to something else? What can this organization do? If I've got an $80,000 wellness budget, but I'm spending it on some stuff that I don't know if I really need. We love having those conversations too, and saying, oh, well, hey, here's a nonprofit that literally does that. Call them and they'll help you take care of that part of it.
Well, I hope that,
kind of vague, but
no, it's good. And I think that between hopefully this podcast and, some of the other things we're posting out there, that this does raise awareness, because I can't even express to you how amazing I think your mission is and what you guys are doing and bringing to the table. And I feel like if we can give you any exposure to do that, we are happy to help. And yeah, and I learned a lot today on this podcast.
Yeah, I think it's one of those things, like it's just great to know that somebody else is doing this, that cares to do this, right? Is bringing the awareness and the need to the forefront. So it's really great. It's also great to know, like, I think you're somewhere close by me. I don't know if you're in Foothill or in Laguna Hill somewhere.
Foothill.
Yep. Foothill. So you're right down the street then.
Yep.
So it's great to see somebody here locally doing it as well.
Indeed. Well, and again, I just really appreciate, the time, the connection. You saw the post and reached out, and it's good to know there's other folks that are out there and helping me get it outside of the public safety, on the police and fire department community, those of us that are working to build technologies and other things to serve them. I think getting the word out amongst your audience is probably almost more important, because we can make things move sometimes faster than they can.
Right.
Well, and I think the thing that what I hope that people take from this is our audience is in GovTech sales for small companies, large companies, right? That hopefully it creates that awareness and exposure within those organizations for them to pick up the phone, send you an email, and say, how do we kind of bring you along, right? Like that's the biggest thing that I hope to get out of it.
And I'd even say on top of that is, don't have to do it through me either. The challenge out there going, take a little part of that marketing budget and figure out what you can do to do good. You're going to get the marketing out of it anyway, because you're going to build a lasting relationship and do good with it, and that's kind of where I went, flying all these conferences, doing all the stuff I do for the normal stuff. I'm like, what if I just did this to do good?
Right.
And, we're lucky to be in an industry that, while things are going to go up and down, we're pretty solid. So I'd throw that out regardless if it's through me. What can your organization do to help support the health and wellness of our responders is even more important than ever calling Lighthouse.
Right.
But happy to chat with them if they want to.
Well, I mean, you bring up a good point. So if somebody did want to chat with you, and we're going to be putting links in the description, where is the best place for them to start? Is it your LinkedIn page? Is it your corporate webpage? Do they reach directly out to you? Do you want to give your personal cell phone number?
I'll give you guys the phone number, the company line, the LinkedIn, the Lighthouse website, any of them. I'm all over it all. So whatever's most convenient for somebody, any which way they can, would be happy to reach back out.
Okay.
Well, Joe, I'm really happy we had this conversation. I've kind of just go a lot of times get lost on LinkedIn to see what I can find, see what I can learn. So I'm happy I ran into you and kind of learned more about it. I'm happy to have you on this call. I'm actually really excited and hopeful of all the things that this can bring. But I'm also would love to have a separate episode at some point in the future to talk about Apex and kind of see how it all began as well too, right? And how you're bringing value there too. So I'm excited to continue these conversations for sure. And hopefully if you're listening to this episode, you pick up the phone, you send the email, you connect with Joe, talk to your agency to see how you can kind of take the torch and run with it as well too, and help out this very important community.
Awesome. Well, thank you guys very much. Again, appreciate the opportunity to share what we're trying to work on.
Yeah, thank you, Joe.
Perfect.
And so that brings us to the end of another GovTech Advisors podcast. Like we said, all the links will be in the description of the episode below. But thanks again for your time today, and we'll talk soon. See you guys.